is Alex.
Hello, my name is Anita. Some water.
We are reporting live from Cypress High School, where there has been a major measles outbreak. Do you have a total body rash or flu-like symptoms? If you do, you might have the measles. For more information, we will go on to Anita, who will explain what the measles are.
Measles is a very contagious respiratory infection. It is an airborne disease. Rubella is another name for the measles. It's known for the 10-day measles. The measles virus first comes in contact with the lung tissue and infects the immune system and dendritic cells. They both are supposed to prevent and be warning systems. The infected cells will migrate to the lymph nodes, then they transfer to B and T cells. Then a surface protein on white blood cells will serve as a virus point of entry. The B and T cells will then travel through the body, releasing the virus into the blood. The spleen, lymph nodes, liver, thymus, skin, and lungs are good spots for the virus to stay in.
Thank you, Anita. Now moving on to Dr. Lopez, who is reporting live from the measles outbreak scene.
Thank you, Alex. This is Dr. Lopez right here reporting live from the measles outbreak scene. The shelter's being built right over there, if you can see from the red dangerous tape. Now, how is measles spread? How do you get infected? How do you end up in there? Well, as you've been told by Anita Some Water, measles is a highly infectious rubella virus that is actually airborne as well, so it's pretty easy to get it. How do you get it? Sneezing, coughing, and even talking can get you infected. It's simple. It's as simple as being in the same room as someone, because it's an airborne virus. It just travels, particles travel around. Okay. Unfortunately, measles can also be spread through sexual intercourse. Sneezing, coughing, just breathing. And infected people can transmit the measles from 4 days before to 4 days after a rash appears. Children under the age of 5 are the most at risk because of their weaker immune systems. In the United States, most measles cases come from international travel on airplanes, like places in Afro-Eurasia that are developing countries or don't have a better access to healthcare like the United States. Okay, now moving on to scientist Oropeza, who is in the lab, who will give you more information about the measles.
Thank you, Dr. Lopez. Doctors can usually diagnose the measles based on the characteristics of the rash: bluish white spot on a bright red background, Koplik spot on the inside lining of the cheek. Many doctors may have not seen the measles before, so they might confuse it with another illness. If necessary, blood tests can confirm whether the rash is truly measles. There are no prescription medications to treat the measles, but there is a 90% chance of contracting it if not injected with the measles vaccine beforehand. The virus and symptoms usually clear up after a couple of weeks. Though there is no prescribed medication for the measles, doctors may recommend acetaminophen to relieve fever and muscle aches. Rest to help boost your immune system, drink plenty of fluids, a humidifier to ease cough and sore throat, and vitamin A supplements. Going back to the studio live with Alex and Anita.
Thank you, Priscilla, for that great information. We will keep you up to date on this case of measles. Tune in tomorrow, where we will interview a 12-year-old kid who grew a potato on his head.